This is Dr. Jamie Koufman, and this is Dr. Koufman's Acid Reflux Hour. Today I'd like to talk about chronic cough. The question is, can acid reflux cause a chronic cough? By way of a disclaimer, you probably wonder if one doctor says to you, all your doctors are wrong, or all your doctors don't understand the underlying problems, or if your doctor says acid reflux, specifically respiratory reflux or reflux that affects the respiratory system, is the main cause of respiratory disease, and this is lung disease and breathing problems, shortness of breath, and so on. The problem is, for you, that of all the symptoms, cough is the most disruptive. So you can get away with a little bit of mucus and throat clearing. You can get away with having, difficulty swallowing or mild hoarseness or any of the other symptoms of respiratory reflux, sinus problems, hearing problems, and so on. But cough is a big, huge, loud, hard to ignore symptoms, particularly if it's often common, occurs at work, occurs in social settings. So cough is, of all the respiratory reflux symptoms, the loudest symptom. If you look at the literature, and I use the word literature figuratively, for example, I went to WebMD and read the most ludicrous article I've ever read. It talked about if you have chronic cough, you're gonna take honey. The chronic cough is caused almost always by two things: smoking and reflux, respiratory reflux, in my experience. So all the things that lurk in the background, pollution, secondhand smoking, and by the way, those things could theoretically cause chronic cough if you were effectively inhaling the same amount of an irritant as tobacco, but secondhand smokers don't. Air pollution, I suppose, caused a lot of cough. In England, in London, when everything was burning coal, both industrial, home, and so on. So, if you look at the whole list of things, I've pulled them, and I'm particularly interested in cough variant asthma. So, in my opinion, that's not a thing. Now, that doesn't say that reflux can't cause chronic cough and cause asthma, because indeed, if you have true asthma, trouble getting air out during an asthma attack, if you have that, turns out most of those are caused by actually acid reflux or respiratory reflux. So reflux is at the root cause of most cough. And this question of cough variant asthma is it really reflux? Is it really respiratory reflux causing both the cough and the asthma? And by the way, and postnasal drip doesn't cause cough. Postnasal drip is caused by reflux, and cough is caused by reflux. But they're not, one doesn't cause the other. They're both sequelae or consequences of respiratory reflux. And let me interrupt myself just to talk about nomenclature. In my opinion, the term GERD, gastroesophageal reflux disease, ought to disappear. It's been a wastebasket for all types of reflux forever. In 1987, I coined the term LPR, or laryngopharyngeal reflux, because I didn't want to say GERD. My patients didn't have heartburn, didn't have indigestion, but they had throat problems. And now it's clear that that's too narrow. Laryngopharyngeal, larynx, and pharynx, but what about all the other manifestations? And so respiratory reflux, in my opinion, is a pinnacle term. Once you've got reflux up here, be it silent reflux or not, then you have a respiratory reflux. And furthermore, I think the term GERD ought to go away even for the GI. A better term would be esophageal reflux. So you have manifestations of esophageal reflux or manifestations of respiratory reflux. So the problem is respiratory reflux affects, 100 million Americans. And chronic cough is one of the most common symptoms. So let's talk about that. First, I want to finish sort of debunking environmental irritants, respiratory infections. Respiratory infections can trigger a cough that lasts for weeks or months, and then it goes away until the next respiratory infection. That's all reflux. It's reflux. It's reflux. And the reflux is lurking just under the surface like an iceberg. So there are no infections. Bronchiectasis, chronic bronchitis, these are, in non-smokers, a reflux. And if you look at my blog, jamiekoufman.com, there are two articles that are really important. But one of them is on a guy who had chronic cough and bronchitis, a young guy, and he was flying between a well-known establishment in New York and another one that dealt with pulmonary and respiratory problems. And he was coughing up blood. And we discovered, of course, that he had terrible reflux. We stopped his reflux, and his cough and his coughing up of blood stopped 6 weeks after his fundoplication. Indeed, he had surgery because of the severity of the problem. He also didn't eat late and didn't drink a lot of alcohol and all the other things that are recommended. So what I'm saying to you is cough is a great huge smoke screen. So let's talk about reflux in cough, because in my opinion it's the number one cause. Why? Well, first of all, reflux occurs at night while you sleep. Most people have silent nocturnal respiratory reflux. And evening meal is the big refueling meal of the day, and so people reflux at night while they sleep, and then they cough during the day. Most people who have reflux-related cough will, from time to time, wake up in the middle of the night coughing and gasping for air like a fish out of water. In my opinion, that is pathognomonic for respiratory reflux. And pathognomonic is a lovely word that says, if you have that symptom, here's the diagnosis, and not some other diagnosis. So if you wake up in the middle of the night coughing, gasping for air like a fish out of water, you don't have silent reflux, but you certainly have reflux-related cough. Now, there are other kinds of cough that I deal with as well, and I'm not going to talk about today. On my website, there's an article on dry cough, which is less common, in fact, very uncommon. So if 100 people come to me, 90 of them have a reflux-related cough. How do you know? They have postnasal drip, chronic throat clearing, a sensation of a lump in the throat, hoarseness, all the rest, difficulty, shortness of breath, all the respiratory reflux symptoms. So it's not that the cough occurs without any other symptom. If you have cough when you go into air conditioning, when a diesel truck goes by and all that, that is what we call neurogenic cough. But if you take neurogenic cough and you put it here, and you put respiratory reflux way up here by my ceiling, this is the important one. And if you fix the reflux, most people won't have cough at all, and the neurogenic part will go away. Now, I don't want to talk about neurogenic cough. Dry cough is the article, and there's an article on treatment as well on the blog. By the way, sign up, jamiekoufman.com. You'll get a notification when each blog comes out, and if you want it, you'll open it. If you don't, you delete it. Also, for those of you who have chronic cough, there is a book which will be helpful to you. It's the only book of its kind in the Chronic Cough Enigma. I'm not in the business of selling anything, but this book will help you, and here's why. You may or may not need help from your primary care physician, not your pulmonologist, and if you show that to your doctor, that may be helpful. So what are the symptoms that also really go along with reflux-related cough? Waking up in the middle of the night coughing, coughing after meals. Here's one, coughing when you bend over. If you cough after you bend over, what that is a notification your lower esophageal sphincter isn't very good right now. Doesn't mean it's not fixable. It is. But the kinds of symptoms that you see are related in most cases to meals, in many cases eating, and especially alcohol. So, how do you make the diagnosis? The statement I'm about to make is going to sound rude, so I want to preface my remark by saying I don't mean it to be rude, but the least informed physicians of all specialists are pulmonologists, or lung doctors. First of all, apparently most of them don't know that trouble breathing in is never asthma. But they see the patient with chronic cough, they do pulmonary testing, they put patients on all kinds of medicine that don't work. They send the patient to the gastroenterologist who has no test for respiratory reflux. GI says they don't have reflux, and the poor pulmonologist is stuck. So read the articles on the blog, because I'm not going to continue to belabor this, because I want to answer some of the questions. But I do want to say a couple more things before I go off this topic, and that is that if you have a wet cough, meaning you bring up, it's productive, you have reflux, or you're a smoker. Now, by the way, if you smoked and you quit smoking 25 years ago, and you have COPD, or you have symptoms, you have lung disease, or you have chronic cough, this is from reflux. 25 years ago smoking, it's gone, that's done. It's just like, when you're 16-year-olds, you got in a car wreck, and you haven't had any problems driving ever since. For all intents and purposes, smoking years and years and years ago has no impact on anything, including lung cancer. So when you talk about chronic cough, one of the ones, the one you really want to worry about, I guess, is cancer. And over the course of my career, I've seen many people with chronic cough who had lung cancer who are lifetime non-smokers without other risk factors. So we know that reflux can cause cancer. In fact, in cell culture, pepsin alone can cause upregulation of all the markers for squamous cell carcinoma. So we know a lot about pepsin and cancer, and we think pepsin causes esophageal cancer, throat cancer, and lung cancer, and certainly cough is related to reflux. Now, the first question I got today is so interesting. Oh, I want to make one other comment. I'm sorry, I almost forgot. If you have a cough and it's terrible and you've got an upper respiratory infection, and then you go to urgent care and you get antibiotics and steroids, whoa. Okay, first of all, most antibiotics make reflux worse. So going on an antibiotic because you have a chronic cough is a bad idea. If it's chronic, it's not an infection that's going to be cured by an antibiotic. And steroids, wow. Well, steroids make everything better, at least temporarily. Problem is 2 weeks later, your reflux is worse. So if you're on antibiotics and steroids, or steroids long term for chronic cough, you have no hope of getting rid of your cough. It's probably reflux caused, and it's not because there's some irritant that comes out of your neighbor's motorcycle. So that's the last thing I want to say about that, except get to the first question, which I think begs the issue of why am I talking at all? And Pamela wants to know, what is the single most effective way to remove pepsin from respiratory tissues? The single way? Well, stop reflux for an extended period of time, completely. So these ideas like, ooh, if I took a better pill, maybe I'll have the surgery. So this involves a program that I call a detox program. And if you look at the website, you'll see that it involves chewing gum after meals, alkaline water spray, a low acid, a low fat diet, and sleeping on an incline, not a little wedge, eating very, very early, finishing early in the day for a 4-week period. It takes about 4 weeks for pepsin to wash out. And the spray is very useful. I don't know where my little bottle is gone, but on the last article on alkaline water, the man looks like he's made out of water. At the very end, you'll see little spray bottles. And if you put your alkaline water in there, that can be very helpful. One of the only ways you can increase or make washout of pepsin more rapid. Why? Because pepsin dies at pH 8, and you're spraying your throat with a pH 9.5. And so chronic cough needs to be treated with a very, very intense program of anti-reflux treatment. If you're on antibiotics, you got to stop. If you're on codeine, you're never going to get rid of it. You got to get off the codeine first, or any other narcotic analgesic. If you're on amitriptyline and gabapentin and it's not doing anything, get off it. So treatment of your reflux is the first thing that needs to be done. So when Pamela says, what's the single most effective way to remove pepsin from the respiratory tissues, the answer is no reflux for 4 weeks. So all the things, no alcohol, right? No eating late, no going to parties. You can't have the chicken Kiev at the wedding, and so on. So it's a big, big program. The idea that you can nibble at the edges of chronic cough or nibble at the edges of respiratory reflux for that matter, it just isn't the case. So as it comes down to, and I've said this many times before, chronic cough caused by reflux is not a medical problem in the sense that there's a better pill, a better doctor, a better procedure. So for people who have reflux-related chronic cough, the only solution is diet and lifestyle, and it is going to be a Spartan experience, at least for 4 weeks. All of it, again, is on the site. Chronic cough and throat clearing, the same thing? Absolutely not. Now, when I have someone who has a chronic cough, I ask, is it mucus and throat clearing? I mean, that's not chronic cough. Getting mucus off your vocal cords. And thick mucus is never allergy. Allergy is thin, it doesn't get on the vocal cords, it doesn't cause cough. Allergy doesn't cause chronic cough, in my experience, allergy alone. So, throat clearing, thick mucus, the respiratory reflux, the respiratory system is lined by mucous membranes, and when irritated with reflux, they make more mucus. It's thick mucus, it's sticky mucus, and it causes a lot of throat clearing. It can mimic a chronic cough. Why don't more medical professionals know about this? Tina, the gastroenterologist, hijacked reflux. They stick scopes down people and put them on Nexium. They sometimes do some testing, but they don't have any tests or any treatment for respiratory reflux. But they're the go-to doctor for respiratory reflux. In fact, there's nothing about respiratory reflux in their curriculum. So why should your ENT, excuse me, there it goes. Why should your ENT or your lung doctor or your primary care know? Because it's not in their curriculum either. Respiratory reflux and chronic cough. And by the way, chronic cough is one of the most common symptoms for which people go to doctors. Now, I know I've been answering questions here and there. They're a little all over the place, but I want to make sure it's clear to you that reflux needs to be taken like a detox program for drugs. It cannot be, I'm going to add licorice, or I'm going to take a PPI because that seems to help. Or none of those things are going to cure your reflux. Proton pump inhibitors cure 0% of people's reflux. A lot of people's heartburn, maybe half of them, but it cures 0%. So my whole pitch is going to continue to be a diet and lifestyle management. And by the way, some of those things are never going to change. Okay, if you eat at 8 o'clock and go to bed at 10, you'll have reflux the rest of your life. There's nothing else that can be done. Okay? You're going to bed with food in your stomach, you're going to reflux all night. Probably every night. And so you have to understand that there are changes that have to be made. If you're a 70-year-old who eats at 8 and goes to bed at 10, even reflux surgery will make no difference. So some people lying down after eating is the big thing. It was for me. I haven't had reflux for years. Last summer I had back trouble, and there I was on the sofa on ice after dinner, and I started to get reflux. A solution, lazy boy, so I could put the ice in the pillow and everything, but not lie flat. So everybody's different, and there may be different variables that are most important. Some people have a trigger food that they adore. One of them can be, for example, coffee. So understand that all of the working out of what causes reflux for you needs to be done in a very, very organized, fastidious, and honest way. You can't pretend that having lunch at McDonald's every day is okay as long as everything else you do is following the, quote, Jamie rules. So, back to question, my most favorite question, I gotta tell you. Vicky, love you. Which comes first, sleep apnea or reflux? Reflux or sleep apnea? I've been told that my reflux is caused by sleep apnea. And it could be that my reflux causes sleep apnea. This is a redundant question. And I wonder how many people use a CPAP machine and suffer from reflux. And big question, does CPAP make reflux worse? Nobody knows. Nobody's tried it. We don't have anybody who has good reflux testing technology. The Medicare reimbursement is so small for reflux testing, and nobody's doing good testing anywhere. I mean, to my knowledge, in the United States. And when the GI puts a capsule in the esophagus, that tells you virtually nothing about whether you have respiratory reflux or not. So the answer, in my opinion, is you have to have silent nighttime reflux for a minimum of a decade or two to develop a snoring and sleep apnea. Snoring earlier. But what happens is the entire pharynx, the tube that goes from your skull base to here, where both your trachea and esophagus enter the chest, that entire tube becomes thickened and swollen. And instead of having the diameter, let's say, of a golf ball, it more has the diameter of a marble. In addition, the uvula, which hangs down, is often huge and banging around on the larynx and tongue base and causing symptoms of its own. So snoring and sleep apnea are, in my opinion, caused by reflux, by respiratory reflux. And to get respiratory reflux, it maybe doesn't take very long, but to get snoring a little longer, but to get sleep apnea, probably 10 or 20 years of nighttime reflux. So then the question is, what comes? Well, if I had a sleep apnea, I would try to find someone who could examine you and say, this is respiratory reflux. There aren't many. You'd be an ENT doctor, not a GI. And then I would buy a bed that would elevate it if you can afford it, or sleep on a high incline. I would eat really early. I would take famotidine, an alginate, and all the other things, alkaline water spray, gum chewing, and so on. So that there is a program, and if you have a combination of chronic cough and sleep apnea, you really ought to go very hard into diet and lifestyle changes, because you're the one who's most likely to get esophageal cancer and lung cancer as well, or throat. So understand that all of these things that we see today are hidden by the fact that respiratory reflux is an entity which is unknown by the medical establishment, for the most part. My cough is like croup, and I've had it for years. ENT specialist says nothing sinister. Well, first of all, there are ENT specialists and there are ENT specialists. If the ENT specialist put a scope down you and then looked into your trachea and your subglot, it'll make you cough, but they're going to stick it down there and they've got to be recording it. They may find that you have a narrow area. The other thing that they can see is that you may have collapsing. If you've had reflux for a very long, it's a malacia. It can be tracheal malacia, where essentially the stiffness of the wall is gone. And so again, long-term treatment. I'm not talking about 6 months to a year. I mean the rest of your life treatment for reflux, in the sense of doing whatever it needs to make it go away. Here's one. I've had chronic cough for 5 years and been diagnosed with GERD. Nothing helps. My cough often produces phlegm. Is this normal? Could it be something more than GERD? Yeah, it's respiratory reflux. Whatever your GERD doctor is telling you is not going to get it done. So, you can't snack at night. You can't drink alcohol. You got to change your life for, a minimum of 6 months or a year. Hard work. When's the last time a doctor sat you down and talked about diet and lifestyle? And by the way, all those weight loss drugs, I've written an article about Ozempic. Guess what they do? They cause reflux. And Ozempic's the worst. They're not all the same. So, The idea that you can find easy ways to solve dietary and lifestyle problems that have essentially ruined your life. You're obese, you have diabetes, and you have sleep apnea, and you have all these things, and you're going to take Ozempic to get thin, increase your reflux. So the idea, people need to take responsibility for diet and lifestyle, and they need to learn about it, because your doctor sure doesn't know much. By the way, neither the naturopaths or dietitians, they don't know much about reflux. So low acid, low fat diet, when you eat's important, and so on. I know I sound like an annoyed, angry school mom, but you know, after a certain number, I mean, I've lectured at Harvard and Hopkins and Mayo Clinic and Cleveland Clinic and UCLA and Vanderbilt. I mean, I've been everywhere, in Europe and the Royal College of Medicine. They've already heard this, I don't know, maybe in the 90s, this same talk. But doctors are not in a habit. I think someday we'll start with a respiratory reflux unit. Will be a physician, say a PA or a nurse practitioner who do all the endoscopies, and then you'll have a dietary and lifestyle coach who will basically be a kid who graduated college, who had an 8-week course and then a 4-week apprenticeship, who can sit down and talk with a patient for 40 minutes if necessary, and work with them over time. And that's the big elephant in the room. American diet and lifestyle is the cause of all this disease, and it's not just reflux, and it's not just chronic cough. So, if you're still coughing, you still have phlegm, you still have reflux, respiratory reflux. Suzanne is interested in a correct diagnosis, been to 6 ENTs and 2 GIs, and no help. So I'm going to tell you what I tell you. If you have respiratory reflux, you can't go to a GI and get a diagnosis. They don't have a test for it. They don't even like the idea of it. And a lot of the big shots in GI, they all know my work, and they're terrified, because if I'm right and we do things properly, we don't need GIs for reflux at all. The endoscopy would be done with an ultra thin in the office, taking 5 minutes, you walk out, no risk of death from anesthesia and so on. And your primary care physician would manage allergies and asthma and acid reflux and postnasal drip and sinus problems. And if they needed a specialist, they get them. You have to be trained in integrated air-adjusted medicine. So you're the doctor. That's the message. I tell people all the time, if you have an orthopedic problem, an orthopedist is the captain of your ship, especially if you require surgery. But if you have respiratory reflux, you are the captain of your own ship. And I recommend you spend an hour a day on my website for the next week. At the end of the week, you'll know more about reflux than 99% of the physicians in America. So jamiekoufman.com is for you. And by the way, all these things are going on YouTube, and I have no experience with social media or YouTube. So you can help me. If this is important talk for you, and you have a friend that's in trouble with anything, chronic throat clearing, drive everyone crazy, or chronic cough, help them out. Give them some information. I do bike riding, sometimes 30, 40, 50 miles. What electrolytes should be used? I see citric acid, but I do need the electrolytes. Okay, so let's talk about bike riding. If you have reflux and you're in a racing bike, you should do that with an empty stomach. You should take an alginate like Gaviscon Advanced before you go. You should take an acid suppressant like famotidine, and know that many people have shortness of breath for the first half hour of exertion, and usually it stops. The electrolytes are not as big an issue as you think, unless they're highly acidic. And so what you need to do is get some pH paper. I mean, if they're pH 2.9, you need to look at another brand, or even potentially make your own. Most things in a bottle or a can are highly acidic, because you don't want to have E. coli growing in your Gatorade. And it never happened because it's pretty acidic. So you have to do the best you can. My experience is I ran around multiple marathons, and you'll never guess what I drank. I drank water, and I did just fine. I actually once finished 77th in a marathon with 11,000 people drinking just water. So, last couple of questions. There are a lot of them this week. I've been following a detox diet, which is not necessarily the whole deal, and I've lost some weight, and I now have a BMI of 19. Guess what? That's normal. My BMI is 18.5, yours is 19. 18.5 to 24.9 is normal. Now, there are a lot of ways to increase calories. Look at the breakfast article. Look at the article on rice. There's a breakfast 600 calories with 60 grams of protein in it, made with rice, olive oil, leftover salmon steak, and 2 egg whites. So you have to find ways of increasing calories, and in many cases, increasing portions. I always tell, I think it's a funny story. I went vegan many, many years ago, and I started gaining weight. And I was so afraid I wasn't going to get enough protein that I was eating really large quantities of things like rice. So there are ways to follow a reflux diet. I mean, I live on predominantly grains and plant-based stuff, with a lot of fish and a lot of poultry, and mostly chicken, mostly chicken breast that I cook. And my weight's been stable. So you understand that this problem is not really, you're going to go to a doctor today and find an answer. The Chronic Cough Enigma is a useful book because it will help you. Here's an example. For people who have chronic cough, if you've also had pneumonia, particularly twice, then you move up to a championship division of reflux. So reflux is everywhere. It's mostly silent reflux, and for the most part, those of you with chronic cough have it, and you're not going to get an answer from your doctor. Final parting shot on that is, please don't take cough suppressive medicines. They do about the same thing as proton pump inhibitors for reflux. They really don't stop the problem, and they can become quite habituated to the point that they're an addiction. So I'm going to follow next time with some discussions of some of the other major symptoms. But understand that chronic cough is one of the most common reasons why people go to a doctor, and almost all of you have respiratory reflux. Not all, leaving smokers aside. Smoking certainly causes chronic cough. But leaving aside smokers, it's probably at least 4 out of 5 of you have respiratory reflux. So I want to thank you. I'm sorry again if I've sounded in any way harsh to my medical colleagues. I would argue in a sense it's not their fault, that once the GIs hijacked reflux, there's no reason why the rest of the physicians dealing with the airway, the pulmonologist, the otolaryngologist, the allergist, would know anything. It's just not in their curriculum. So until next time, stop refluxing.